Hello, all. My name is Darius Ford, and I am one of your fellow students in the CRM 703 leadership course. For all of you, this is your first time seeing my face. So, this is my official virtual hello, and I really look forward to watching your video responses to this week's scenario. So, I'm placed in a position where I'm the CEO of a small biotech company. I want to pause and I want to emphasize that we are a small biotech company. And this is going to be very important when I'm deciding on how I'm going to respond to the media. So I am the CEO of this small biotech company, and we are approaching the second phase of an antiviral clinical trial. The media knows that we've had some very positive and promising results. And as a result of that, they want us to push forward the release of this product to the market. I would assume they would like, us to do some accelerated type of model in our trial to accelerate the trial and to make the availability of our product much faster than it would on a traditional trial. So I would have no issue with this if we were in the third phase of the trial. Reason being that we would have enough safety data to back up and support the early release of our drug, because we've gone through the first and the second phase, which typically focus on safety. But since this is not the case here, I'm very uncomfortable releasing this drug to the market because I'm just not willing to risk and compromise the safety of the patients. If this was a company that I was a CEO for, our model would be safety and finding a cure. So if we're looking at that first part, safety, it would be contradictory for me to release a drug prematurely to the market when we don't have enough safety data. So for that simple reason, I would refute any idea of releasing this drug to the market prematurely. Now, if we look at it on the business side of things, it's very attractive for a small biotech company to go mainstream. Releasing this drug to the market prematurely or early would really accelerate our business, and we would be mainstream at this point, and we would be more marketable to future companies who want to market our drug. Since we are a small biotech company, these types of things are very attractive. And of course, every business, they have a goal of growing and being successful, every business. So I would understand the urge to want to do that. But what happens if we do put this drug on the market and we have some really bad sustained clinical responses, and the patients, the public, are reacting negatively to our drug, ultimately harming those same patients that we aim to heal? What happens to the business? Our business could plummet. We could lose our business. And with that, our employees will be out of a job. If I'm the leader of this organization, my whole goal is to ensure that my employees' jobs are safe. I'm not willing to gamble their jobs off of the mere chance that this product that we don't have a lot of safety data on might do well in the public because the media is pressuring us. As a CEO, I have to be able to stand firm in our decisions and stand firm behind our model. And like I said, our model is safety, and it's to find a cure for the patients. Now, this doesn't mean that we couldn't have some sort of adaptive design to our trial. We could widen our approach and widen our recruitment efforts, or look at places that have the disease more and target those places where our trials will be. We could design our trials in many different ways. I would not move forward with a compassionate use of drugs, because we are a small biotech company, and I think that would be very hard for us to manage as a small biotech company. We're trying to market this company too. So as a leader, I want us to go through all of the phases. We need more full phase trials under our belt because we are small. With that being said, I'm not moving forward with putting this on the market. We're going to put our heads down. We're going to get to work. We're going to stick to the script. And we're going to continue our research and upholding our truths as scientists and making sure that we provide the public with the best and the safest product.